SAM-E is a compound that's made naturally in the body and plays an important role in normal bodily function. A synthesized form of SAM-E is considered a supplement in the US, but SAM-E has been sold as a prescription drug in parts of Europe for decades. Its scientific name is S-adenosylmethionine. SAM-E is also known as adenosylmethionine and SAMe. Why do people take SAM-E? SAM-E has some evidence as a treatment for osteoarthritis pain. Some studies have found that oral SAM-E is as effective as NSAID painkillers, such as ibuprofen and Celebrex. SAM-E takes longer to act than drugs do, but it also has fewer side effects than NSAIDs. SAM-E has also been used to treat depression for many years. Some studies have found that SAM-E might work as well as tricyclic antidepressants in relieving symptoms. However, many of these studies were flawed or too small to be conclusive. Other uses of SAM-E have not been studied as thoroughly. There's some evidence that SAM-E might help ease the pain of fibromyalgia and spinal cord damage caused by HIV. SAM-E may also help control cholestasis, a buildup of bile in the liver, particularly in pregnant women during the third trimester. One trial suggested that SAM-E might be helpful for adults with ADHD. However, more research needs to be done. Some people use SAM-E as a treatment for other conditions, such as liver disease, Alzheimer's disease, pain, migraine, and bursitis. We don't know the potential risks or benefits of these uses. How much SAM-E should you take? There is no established ideal dose of SAM-E. For depression, many studies have started patients at 400 to 600 milligrams daily. For osteoarthritis, 600 to 1,200 milligrams daily of SAM-E divided into 3 doses is common. Ask your doctor for advice. Sometimes, the dose of SAM-E is increased gradually over a few weeks. This can help reduce side effects such as restlessness or anxiety. Can you get SAM-E naturally from foods? There are no food sources of SAM-E. What are the risks of taking SAM-E? Side effects. SAM-E seems to be a relatively safe drug. High doses of oral SAM-E can cause symptoms like gas, upset stomach, diarrhea, constipation, dry mouth, headache, dizziness, anxiety, and skin rashes. SAM-E can also trigger an allergic reaction in some people. Risks. If you have any medical issues, check with a doctor before you start using SAM-E supplements. SAM-E might not be safe for people with conditions such as bipolar disorder, Parkinson's disease, and diabetes. Because SAM-E can affect the blood vessels, stop using SAM-E 2 weeks before getting surgery. Interactions. If you take any medicines regularly, talk to your doctor before you start using SAM-E supplements. SAM-E could be dangerous when combined with antidepressants or supplements that treat depression, like St. John's wort. SAM-E could also interact with some prescription painkillers, cough medicines, and treatments for diabetes and Parkinson's disease. Patients taking MAOIs should not use SAM-E without discussing it with their doctor. Given the lack of evidence about safety, SAM-E is not recommended for children or for women who are breastfeeding. Although SAM-E has been studied as a treatment for liver problems during pregnancy, pregnant women should only use SAM-E if a doctor recommends it.